New data quietly published online shows that bulk billing rates have stagnated since last year. The opposition says it shows that too many people can't afford to see their doctor, but health experts say the government incentives haven't been given enough time to kick in. For more on this, we are joined by political reporter Claudia Long. Hi Claudia, can you just explain what the bulk billing rate is and what the data shows?
That's right. So the bulk billing rate is essentially the number of GPs who are bulk billing their patients, really. It's when you see your doctor for free. It's covered entirely by Medicare. And the rate has stayed it's stagnated, stayed the same since this time last year at 77.6%. Now, there's also some other interesting data that's been quietly published today, or rather last night, showing that for the first time ever, the average out-of-pocket cost per patient has gone up above $50. Now, the opposition say that this is potentially having a pretty negative impact around the country. They say that it speaks to the fact that seeing a GP is too expensive and that not enough people are able to do it, and that that's eventually landing them in hospital rather than being able to see somebody before they get even more sick. And the other, aside from the human cost, the economic cost of people going to hospital rather than being seen earlier in their illness is quite expensive. Now, the federal government has been trying to manage this. They've actually increased the bulk billing incentive for GPs. So previously, that only applied when you were seeing somebody who was a concession card holder or a young person, but during the election campaign, they actually broadened that out to be any patient. But those changes only came into effect just at the start of this month. They've been in for less than a month, and so these aren't actually captured in this data.
Right, so we're not seeing yet whether those incentives will make a difference. But what are health experts making of these figures out today?
Essentially, wait and see. That's kind of the message that we're getting from people, including health economist Stephen Duckett, who said this is really too soon to say if what the government is doing has actually worked. And he's expecting to see probably more results over the next 6 months. He says that's certainly what the government's going to be hoping to see. We've heard from the head of the Australian Medical Association as well. They've said that this also, again, needs more time to work. It's hard to say yet whether it will or it won't. But for the AMA's part, they're also calling for a broader overhaul of Medicare. They're saying that it's not quite fit for purpose anymore because we've got an ageing population, and of course, as you get older, you have a few more problems, definitely a few more health problems, and that there need to be more specific Medicare rebate items to deal with particular appointments for elderly people and those with chronic health conditions. So they're calling for a much broader overhaul of that system, but they're saying wait and see to find out whether what the government's doing has worked.